Cataracts are a common eye condition that affects millions of people worldwide, especially as they age. The clouding of the eye's natural lens leads to blurry vision, difficulty seeing at night, and sensitivity to light. Early detection and evaluation are crucial for effective management and treatment. In this video, we'll explore the most commonly used tests to evaluate cataracts, helping you understand how eye care professionals diagnose and monitor this condition. Let's begin by understanding what cataracts are and why proper evaluation is important for maintaining eye health. One of the first steps in evaluating cataracts is the visual acuity test. This test measures how well you can see at various distances, typically using a Snellen chart with rows of letters that decrease in size. The patient reads the letters aloud, and the results help determine the extent to which cataracts are affecting vision. Visual acuity testing is quick, non-invasive, and provides valuable information about the clarity of vision. It's often the starting point for further eye examinations and helps guide the next steps in cataract evaluation. The slit-lamp examination is a key test for evaluating cataracts. Using a specialized microscope with a bright light, the eye care professional examines the front and back parts of the eye in detail. This test allows for a close look at the lens, cornea, and other structures, making it possible to detect clouding and other abnormalities. The slit lamp exam is essential for assessing the severity and type of cataract, as well as identifying any other eye conditions that may be present. It's a standard part of a comprehensive eye exam. A retinal examination is performed to evaluate the health of the retina and rule out other causes of vision loss. The doctor may use special eye drops to dilate the pupil, allowing a better view of the retina. This test is important because cataracts can obscure the view of the retina, making it harder to detect other eye diseases. By carefully examining the retina, the eye care professional can ensure that vision problems are not solely due to cataracts and can plan appropriate treatment. Tonometry is a test used to measure the pressure inside the eye, known as intraocular pressure. While not directly related to cataracts, it's an important part of a comprehensive eye exam because high eye pressure can indicate glaucoma, another condition that affects vision. The test is quick and painless, often performed with a small device that gently touches the eye or uses a puff of air. Monitoring eye pressure helps ensure that cataracts are not accompanied by other serious eye conditions. Contrast sensitivity testing evaluates how well you can distinguish between shades of gray and detect objects against backgrounds. Cataracts often reduce contrast sensitivity, making it harder to see in low-light conditions or when there's glare. This test involves looking at patterns or images with varying levels of contrast. Results help determine how much cataracts are affecting daily activities, such as driving at night or reading in dim light. It's a valuable tool for assessing the functional impact of cataract. Glare testing measures how well your eyes handle bright lights, which is often a problem for people with cataracts. During this test, you may be asked to read letters or identify objects while exposed to a bright light source. The results indicate how much glare affects your vision and whether cataracts are causing significant discomfort. Glare testing is particularly important for people who drive at night or work in environments with strong lighting, as it helps guide treatment decisions. Cataracts can affect color perception, making colors appear faded or yellowed. A color vision test checks your ability to distinguish between different colors and shades. This test usually involves identifying colored shapes or patterns on a chart. Changes in color vision can indicate the progression of cataracts and help determine the best time for treatment. It's a simple but effective way to monitor how cataracts are impacting your overall vision quality. Pupil dilation is a procedure used to enhance the effectiveness of several eye tests. Special eye drops are applied to widen the pupil, allowing the doctor to examine the lens, retina, and optic nerve more thoroughly. Dilation is especially important when evaluating cataracts as it provides a clearer view of the lens and helps detect other potential eye problems. While the effects of dilation are temporary, it's a crucial step in comprehensive cataract assessment. Ophthalmoscopy is a test that uses a special instrument called an ophthalmoscope to examine the inside of the eye. The doctor looks through the pupil to assess the lens, retina, and optic nerve. This test helps identify cataracts and other eye conditions that may affect vision. Ophthalmoscopy is often performed after pupil dilation, providing a detailed view of the eye's internal structures. It's an essential part of the cataract evaluation process. The refraction test determines the best prescription for glasses or contact lenses. During this test, the patient looks through a device called a phoropter, and the doctor changes lenses to find the combination that provides the clearest vision. Cataracts can cause changes in refractive error, so this test helps measure the impact on vision and guides recommendations for corrective lenses. It's a routine part of eye exams and important for monitoring cataract progression. Corneal topography is a test that maps the surface curvature of the cornea. While it's not directly used to diagnose cataracts, it's helpful in planning cataract surgery and ensuring optimal vision correction. The test uses advanced imaging technology to create a detailed map which guides the selection of intraocular lenses and surgical techniques. Corneal topography is especially important for patients with irregular corneas or other eye conditions. Optical coherence tomography, OCT, is a non-invasive imaging test that provides high-resolution cross-sectional images of the retina and optic nerve. OCT is valuable for detecting retinal diseases that may coexist with cataracts and for assessing the thickness and health of retinal layers. The test is quick and painless, offering detailed information that helps guide treatment decisions and monitor eye health over time. Ultrasound biometry is used to measure the length of the eye and the thickness of the lens. This information is crucial for planning cataract surgery and selecting the appropriate intraocular lens. The test involves placing a small probe on the eye's surface, which emits sound waves to create detailed measurements. Ultrasound biometry ensures precise surgical outcomes and helps tailor treatment to each patient's unique needs. The Amsler grid test is used to detect changes in the central vision, which can be affected by cataracts or other retinal conditions. The patient looks at a grid of straight lines and reports any areas that appear wavy, blurry, or missing. This test helps identify macular problems and monitor the impact of cataracts on central vision. It's a simple and effective tool for ongoing eye health assessment. A visual field test measures the range of vision, including peripheral vision. Cataracts can sometimes affect the field of vision, so this test helps determine the extent of vision loss. The patient responds to lights or objects appearing in different areas of their visual field. Results are used to monitor progression and guide treatment decisions, ensuring comprehensive evaluation of all aspects of vision. Lens opacity grading is a process used to classify the severity of cataracts based on the degree of lens clouding. Eye care professionals use standardized scales and imaging techniques to assign a grade, which helps track progression and plan treatment. Accurate grading is essential for determining the best time for surgery and for monitoring changes over time. This test is a cornerstone of cataract evaluation. Gathering a detailed patient history is an important part of cataract evaluation. The doctor asks about symptoms, medical conditions, medications, and family history of eye diseases. This information helps identify risk factors and guides the selection of appropriate tests. Understanding the patient's background ensures a personalized approach to cataract management and supports optimal outcomes. Assessing symptoms is a key step in evaluating cataracts. Patients describe their vision problems, such as blurriness, glare, difficulty reading, or trouble seeing at night. The doctor uses this information to determine the impact of cataracts on daily life and to prioritize tests and treatments. Symptom assessment ensures that care is tailored to each individual's needs and concerns. Reviewing family history helps identify genetic risk factors for cataracts and other eye diseases. The doctor asks about relatives with vision problems or eye surgeries. This information can influence the choice of tests and guide preventive strategies. Family history review is a simple but important part of comprehensive cataract evaluation. A medication review is conducted to identify drugs that may contribute to cataract development or affect eye health. The doctor asks about current and past medications, including steroids and other treatments. This information helps avoid potential complications and ensures safe management of cataracts. Medication review is a routine part of eye exams and supports holistic care. Lifestyle assessment involves discussing habits and activities that may influence cataract development or progression. The doctor asks about smoking, diet, sun exposure, and occupational risks. Understanding lifestyle factors helps guide recommendations for prevention and supports long-term eye health. Lifestyle assessment is an important part of personalized cataract care. A physical eye examination is performed to assess the overall health of the eye and detect signs of cataracts. The doctor examines the eyelids, conjunctiva, cornea, and lens for abnormalities. This hands-on assessment provides valuable information and helps identify other conditions that may affect vision. Physical examination is a fundamental part of cataract evaluation. Anterior segment imaging uses advanced technology to capture detailed images of the front part of the eye, including the cornea, iris, and lens. This test helps detect cataracts and other structural abnormalities. Imaging results guide treatment planning and support precise diagnosis. Anterior segment imaging is especially useful for complex cases and surgical preparation. Posterior segment imaging focuses on the back part of the eye, including the retina and optic nerve. This test is important for detecting coexisting eye diseases and monitoring the impact of cataracts on vision. Advanced imaging techniques provide high-resolution pictures that support accurate diagnosis and treatment planning. Posterior segment imaging is a valuable tool in comprehensive eye care. Pachymetry measures the thickness of the cornea, which can influence cataract surgery outcomes. The test uses a small probe or imaging device to obtain precise measurements. Knowing corneal thickness helps guide surgical planning and ensures safe and effective treatment. Pachymetry is especially important for patients with corneal disease or those considering advanced surgical techniques. Specular microscopy is a test that examines the cells lining the cornea, known as the endothelium. This test is important for assessing corneal health before cataract surgery. The results help identify risks and guide surgical decisions, ensuring optimal outcomes. Specular microscopy is a specialized tool used in advanced eye care. Endothelial cell count measures the number of cells in the corneal endothelium. This information is vital for planning cataract surgery and ensuring corneal health. Low cell counts can increase the risk of complications, so the test helps guide treatment and monitor recovery. Endothelial cell count is a routine part of pre-surgical assessment. Keratometry is a test that measures the curvature of the cornea. This information is used to select the appropriate intraocular lens for cataract surgery and to ensure optimal vision correction. Keratometry is quick and non-invasive, providing valuable data for surgical planning and personalized care. Ocular surface assessment evaluates the health of the eye's surface, including the tear film and conjunctiva. This test helps detect dry eye, inflammation, or other conditions that may affect cataract surgery outcomes. Proper assessment ensures safe and effective treatment and supports overall eye health. Tear film analysis measures the quality and quantity of tears produced by the eye. Dry eye can complicate cataract surgery and affect recovery, so this test is important for planning treatment. Tear film analysis uses specialized tools to assess tear production and stability, guiding recommendations for pre- and post-surgical care. Eye movement assessment checks the coordination and function of the eye muscles. This test helps detect problems that may affect vision or complicate cataract surgery. The doctor observes how the eyes move in different directions and responds to stimuli. Eye movement assessment is a routine part of comprehensive eye exams. Accommodation testing evaluates the eye's ability to focus on near and distant objects. Cataracts can affect accommodation, leading to difficulty with reading or other close-up tasks. The test involves changing focus between objects at different distances and measuring response. Accommodation testing helps guide recommendations for vision correction and supports personalized care. Binocular vision testing assesses how well both eyes work together. Cataracts can disrupt binocular vision, causing double vision or difficulty with depth perception. The test involves looking at objects with both eyes and measuring alignment and coordination. Binocular vision testing is important for ensuring safe and effective vision correction. Stereopsis testing measures depth perception, which can be affected by cataracts. The test involves viewing special images or objects and determining how well the eyes perceive three-dimensional space. Stereopsis testing is important for activities like driving and helps guide recommendations for vision correction. Eye alignment testing checks for strabismus or other alignment issues that may affect vision. Cataracts can sometimes cause or worsen alignment problems. The test involves observing eye position and movement, ensuring both eyes are properly aligned. Eye alignment testing supports accurate diagnosis and safe vision correction. Eye pressure monitoring is performed regularly to detect changes that may indicate glaucoma or other eye conditions. Cataracts can coexist with high eye pressure, so ongoing monitoring is important for comprehensive care. The test uses tonometry or other devices to measure intraocular pressure and guide treatment decisions. Eye health screening involves a series of tests to assess overall eye function and detect early signs of cataracts or other conditions. Screening is important for prevention and early intervention, supporting long-term vision health. Regular eye health screening is recommended for all adults, especially those at risk for cataracts. A comprehensive eye exam combines multiple tests to evaluate all aspects of vision and eye health. The exam includes visual acuity, slit-lamp, retinal examination, and other specialized tests. Comprehensive exams are essential for diagnosing cataracts, monitoring progression, and planning treatment. Regular comprehensive eye exams ensure optimal vision and support lifelong eye health. Pre-surgical assessment is performed before cataract surgery to ensure safe and effective outcomes. The doctor reviews test results, evaluates eye health, and discusses surgical options. Pre-surgical assessment includes imaging, biometry, and other specialized tests. Thorough evaluation supports personalized treatment and minimizes risks. Post-surgical monitoring is essential after cataract surgery to track recovery and detect complications. The doctor performs regular exams and tests to ensure proper healing and optimal vision. Monitoring includes visual acuity, eye pressure, and imaging. Post-surgical care supports long-term eye health and successful outcomes. Patient education is a vital part of cataract evaluation and care. The doctor explains test results, treatment options, and preventive strategies. Education empowers patients to make informed decisions and supports adherence to care plans. Ongoing education ensures that patients understand their condition and participate actively in their eye health. Follow-up care involves regular visits to monitor cataract progression and eye health. The doctor performs ongoing tests and adjusts treatment as needed. Follow-up care is essential for detecting changes early and ensuring optimal outcomes. Consistent monitoring supports lifelong vision, health, and effective cataract management. In summary, evaluating cataracts involves a variety of tests that assess vision, eye health, and the impact of lens clouding. From visual acuity and slit-lamp exams to advanced imaging and biometry, each test provides valuable information for diagnosis and treatment. Comprehensive evaluation ensures personalized care and supports optimal outcomes for patients with cataracts. Cataract evaluation is a multi-step process that combines patient history, symptom assessment, and a range of specialized tests. Early detection and thorough evaluation are key to maintaining vision and planning effective treatment. By understanding the tests commonly used to evaluate cataracts, patients and caregivers can make informed decisions and support lifelong eye health. Thank you for watching, and remember to schedule regular eye exams for optimal vision.